Welcome back, healthcare hopefuls. Thanks for joining me. I'm sorry I've recently taken a bit of a hiatus from filming because I was working on finishing my MBA, but I'm officially done. So I'm going to get back into posting on a more regular cadence. This is a reminder that I'm not a physician, I'm not a clinician, and this information is educational and informational only in nature. It should not be considered medical, legal, or financial advice. All right, so let's get into it. As a patient, have you ever been to the hospital, had a procedure done or surgery, maybe even labs, and then weeks later received a bill that was much higher than you anticipated? If so, you're not alone. One of the biggest frustrations that patients face is not knowing what healthcare will cost before they receive the service. It's not like buying a car or booking a hotel or even going out to a restaurant where you know the price in advance. Healthcare prices oftentimes feel like a mystery. That's starting to change a little bit. Today we're going to discuss why healthcare prices have been so difficult to understand, what new transparency rules mean for you as a patient, and what you can do before receiving care to avoid some of these unexpected costs. So, why are healthcare prices so confusing? One of the many reasons is because many people assume when it comes to a medical service, there should be one cost associated. Unfortunately, healthcare isn't that simple and it doesn't work that way. A hospital may have one price for a procedure, while your insurance company has negotiated another completely different rate, or the chunk that they are willing to pay for you based on your coverage, but then there's another cost that you have to pay as the patient. On top of that, a single medical visit can involve multiple bills, and that further complicates things. A perfect example is if you have surgery, you might receive separate bills from the hospital, the surgeon, the anesthesiologist, the radiologist, or even the laboratory. This is one reason why patients are often surprised once their bill arrives. But there's something called hospital price transparency. What does that mean? The federal government has been working to make healthcare prices a little bit more visible to patients. Under the hospital price transparency rules, hospitals are required to make pricing information available to the public, including standard charges, negotiated insurance rates, and self-pay prices. Hospitals are also required to provide consumer-friendly pricing information for hundreds of commonly scheduled services. In fact, CMS, or the Center for Medicare and Medicaid Services, recently strengthened these requirements and began enforcing the updated transparency standards this year in 2026. The goal is simple: to help patients understand healthcare costs before receiving their care. But here's the important part. Just because pricing information is available doesn't necessarily mean it's easy to understand. You still need to ask questions. Many hospital prices, their files contain thousands of services, and it can be difficult for the average person to navigate. So while transparency is still improving, patients need to ask questions and advocate for themselves. What's a good faith estimate? A good faith estimate is one of the most important tools at your disposal as a patient. Under federal law, patients who are uninsured or choose to pay for the care themselves can request a good faith estimate before receiving non-emergency care. The estimate should include expected charges for services, hospital fees, facility fees, and other related costs by that provider or facility. If multiple providers are involved in your care, you may need to receive estimates from each of them, because these estimates are often issued separately. Many patients have never heard of this right, but it can be incredibly helpful when planning for your medical expenses in advance. But then there's the question, what if you receive a bill and the bill is much higher than the good faith estimate that you originally received? According to CMS, if you're uninsured or self-pay and your bill is substantially higher than your good faith estimate, you may have the right to dispute the bill through a federal patient-provider dispute resolution process. CMS states that patients may be eligible to challenge bills that exceed the estimate by at least $400. That's why it's important to keep copies of any estimates you may receive, so you can refer to them later. Here are some questions that every patient should ask before scheduling a non-emergent procedure, test, or surgery. Consider asking the following. Is this provider in network with my insurance? That's important. There's a much larger cost tag associated with an out-of-network provider compared to an in-network provider. Can I get a written estimate of expected charges? Are there separate physician fees? Will I receive bills from multiple providers? Is there a self-pay or cash pay option? That's important because sometimes there's discounts associated with that option. Is financial assistance available? And can I receive a good faith estimate? These questions can all help you avoid surprises and make more informed decisions about your care. My personal perspective as a patient advocate, somebody who's passionate about patient advocacy, I believe that understanding healthcare costs is a part of understanding the healthcare itself. Patients should never feel embarrassed to ask about the costs associated with receiving services, especially services that they are paying their hard-earned money for. Healthcare decisions affect not only our health, but also our finances, our families, and our mental well-being. The good news is that transparency efforts are moving healthcare in a positive direction. The challenge is making sure patients know their rights at all times and know how to use the information that's available to them. I'd love to hear about your personal experiences in the comments below or anything else that you'd like me to discuss in these videos. If you found this video helpful, please like, subscribe, and share it with someone who could benefit from learning about navigating healthcare and advocating for themselves as well. And remember, being an informed patient is one of the most powerful forms of healthcare advocacy. Thanks for watching. See you next time.